Purpose of an annual wellness visit is to focus on prevention. And we like to take the time with our patients to really talk about preventative medicine and what that really means. My name is Dr. Cheng Ron here at the Texas Center for Lifestyle Medicine. Today I'm going to talk about annual wellness visits. So, depending on your insurance, most insurances, there's no out of pocket for annual wellness visits as long as the visits actually performed within guidelines. So, what are those guidelines? I'm about to tell you. So, as part of the annual wellness visit, we talk about prevention. So, for women, it could be breast cancer screening, it could be cervical cancer screening, and for women and men, it could be talking about vaccinations, immunizations, and colonoscopies or other methods of colon cancer screening. So it really depends on your gender and age group. We're really going to talk about, during these sessions. And if you've had these done before, we want to be able to get those records and see and compare and order the appropriate things. Another one that we do is bone density. There's actually guidelines for women and men actually for bone density screening as well. And so all these things we want to be able to talk about in the preventative visit portion of the annual wellness visit. There's a second portion of the visit, which is the actual physical exam, and it's a general physical exam, and that is making sure your numbers in terms of your blood pressure and heart rate and other vitals are okay. And then there is an exam by your clinician to make sure there's general heart and lung and abdomen exams, make sure there's no swelling in the legs or anything like that. And just general exams so that we're able to pick up some things. And if we do pick up some things on that visit, we may schedule another visit to focus on things that we have picked up during that specific visit. So there's also some general labs that may be covered in the annual wellness exam. And that includes, for example, a cholesterol panel, and then also assessing for a thyroid screen or kidney and liver functions. Um, Now, the biggest misconception about an annual wellness exam during the visit is that most patients think that other things will be covered. And when I say covered, I'm talking about financially covered. So your insurance may only cover the preventative part of the annual wellness exam. But if we actually talk about other things that may be for a specific disease or illness or symptom, that actual portion may not be fully covered under that day, under that exam. So, a very big misconception there. And so a lot of times when we are dealing with insurance companies and on a day with the annual exam, and we have to deal with something else that's really urgent or pressing for the patient at that particular time, that service actually may or may not be covered within that scope of the annual wellness exam. Like I said, it really depends on the insurance. But it may seem really inefficient to go to your doctor and get an annual wellness exam and not talk about the other things that may be bothering you. For example, you may have a cold, or may have a rash, or you may have abdominal discomfort or anything like that. So and part of the reason why this is not covered within the annual wellness is because we want to be able to dedicate time specifically for prevention, for preventative medicine. And that does take some time as well. And so the allocation of the time and resources are for prevention. And so if there are any other issues in terms of medical issues, we may choose to address it at a different time to not take away the time that we'll be talking about during a preventative annual wellness exam. Thank you very much.